invite Dr. Virendra Agrawal, and he'll be talking on presbyopia correcting IOL. Holy Grail, he'll CR with the answer. So I think that's in addition to the talk we already had on synergy. So let's hear his personal experience.
Thank you, Sonu, and thank you, Ayaz, for giving me this opportunity to share my experience with the Synergy IOL. And as you all know that the time is coming when the things are changing in a sense that you require something more than the monofocal lenses. And everybody is speaking something plus or minus for the lenses. The question is that we need really something beyond monofocal. So the question must be understood that the patients who are having cataract, I'm not saying for the clearance section, are having some or other visual disturbances, and to cover that it up, I don't have any financial interest in any of the lens or the lenses I am going to discuss. So monofocal or monofocal plus is not the only answer, because the patient require much more vision, and particularly for the Asian eyes, you require a distance and near vision at a slightly closer distance. Not 40 or 60 centimeter is required. We require actually at 33 or less than 33. So there are so many studies, and the patient profile is changing, and affordability is also changing. I still mean that the patients who are not having to afford the high cost lenses can go for monofocal or monofocal plus, but definitely given the choice, and as Dr. Mehta has said, the ultimate cost comes less for the multifocal or bifocal or trifocal or the continuous range of vision lenses. That is the reason that it can be a lens of choice for every state of life, the scenario. And we have to fill in the gap which was there with the bifocal and trifocal. The bifocal and trifocal, you can see there were 2 or 3 clear focus, but these are not the life scenarios, and what we require is a continuity of vision. And as Sonu has said, I will go fast, so I will have less of the slides presenting. And this continuous range of vision lens, you can see that actually this from here to here, it is within the range where it can give vision of comfortable level. There are other lenses just to show the comparison. There is a trifocal from the Zeiss, from the Alcon and Physiol. So they all are not having the continuity into that sense, but they are also good lenses. And trifocal lenses, I'm just going to show again the MTF and the Logmar visual acuity. They are different lenses calculated and analyzed, but their distance, near distance was more than 36 centimeter. And that is not there particularly for the females, because the shorter arm length, and even Indian males also don't have a comfortable distance beyond 33 centimeters. It is a good mix of two things which Ajay Sharma has already pointed out, the multifocal and the symphony lens. But the important things are that basically why the quality of vision is good with the Synergy lens is that the chrome aligned technology is one thing, then Ashlet design is another thing, and a violet light filter. So these two things, the Ashlet design and chrome aligned technology were there in the Symphony also, but that was not having a good vision for the near vision. So now adding with the multifocal part into it, we are having a good near vision, intermediate vision, distance vision, and that too with the continuity. So that is the main reason the patient's expectations are fulfilled and they are happy. The violet light filter plays a role in particular today's life where we are having more of LEDs and they emit violet light that causes more of a glare. That was the issue mainly for the night driving, and many of the people among ourselves as a doctor don't advise, and many of the patients are afraid of that they will be not able to drive. Somebody has shown in the beginning previous talks that somebody who is doing a regular night driving. I want to just add on the word regular night driving from work place to home, that is around city driving for 2 to 5 or 10 kilometers is not a contraindication. Those who are doing regular highway driving for their professional reasons can be candidates who are not very good for these kind of lenses, but rest all can be a good candidate. And unless you explain them what is the need of the near vision in day-to-day life, they don't understand the importance of it. And many of the patients who actually, because of some or other reasons, because of the taking opinion from the different colleagues, they go for monofocal, and after implanting them, they come, sir, I have gone for a wrong decision, can you change it? I am not advising to explant the lens and implant this lens, but we should give more enough time for the patient to understand the importance of these kind of lenses, then the majority are opting it. So that is the reason that I keep telling to the patient that my first choice is this lens, and then comes the advanced monofocal and then monofocal. And no negative for any company, but when they compared between the Synergy and Panoptics, the conclusion was that the Synergy has shown the extensive range of vision, particularly through near distances and better mesopic performance than Panoptic patients undergoing cataract surgery, and the same is my experience. And this is because of this reason that when you compare this part, this is the Panoptics and Synergy. The difference is that at what distance they are maintaining the vision for near, and because of this, the Indian patients are more happy. I am not going to detail what preoperative has done because Dr. Ajay Sharma has clearly highlighted. Dry eye is the most important, topography is another important point. And why I am saying topography is important, like in this patient, you are seeing the cylinder is just 0.5, you can avoid it. But when you do a topography, then you realize it is having a dry eye effect. And because of this, the dry eye patient need to be treated first. If dry eye improves, then only go ahead. But otherwise, all sorts of patients, all professions can be done. I'm just going forward. And the conclusion is the visual needs are changing, visual expectations are changing, demands are changing, and because majority of the patients and doctors are now implanting, we have enough pool of these diffractive lenses implanted. So the patient's understanding and patient expectations are also changing, and they are accepting it much better. Even before surgery, their neuroadaptation is coming into play, that at the cost of rings, they are getting better quality of life. And as Dr. Mehta was saying, the quality of life is the most important thing. If we impress upon them that somebody was telling me in the morning that how much time you do driving or something is less than half an hour, and rest of the time you require a quality of vision, so go for these kind of lenses. So this is my also opinion that independence from glasses for majority of the distance or reducing the dependence on the glasses is the need of the time, and CRV fulfills this kind of lenses needs. So my choice for CRV is that I should go for all patients unless they are having some negative of the dry eye, macular pathologies or corneal irregularities, we should go for this kind of lens. Thank you very much. Sonu, I hope I have saved your time.
No, thank you very much.
Thank you, sir, for